This channel does not suggest use of any medicine or test shown in the video. This is for educational purpose only. If you are suffering from cough, cold for a long time and you are taking medicine but it is not curing and relapsing again and again, then this video is for you. First of all, let's try to understand symptoms of influenza and pneumonia. In case of influenza, symptoms are fever, muscle pain, chills, cough, weakness, diarrhea, rhinitis, sore throat, headache. In case of pneumonia, the symptoms are high fever, then cough with some yellow or greeny or bloody mucus, then tiredness, rapid breathing, shortness of breath, feeling of chills and sweating, chest pain, loss of appetite, and bluish skin or lips or bluish nails, and then confusion or altered mental state. So, see the prescription of a patient, 66-year-old. He was suffering from frequent cough throughout the year and he has several other complications as well. So, doctor prescribes 2 vaccines for the patient, and these 2 are Influvac Tetra 0.5 ml intramuscular once in a year, and another one is injection Pneumovax 23 0.5 ml intramuscular once only. So in this video I will talk on vaccination for influenza and pneumonia, why you have to take this one, when you have to take this one, how many times you have to take in a year, and who can take this, and how this vaccine acts. So all these points will be discussed here. So as you know, these symptoms like pneumonia and influenza can be treated by oral medication, but vaccine is also available. So as per this prescription you see, so who can take this vaccine? So first of all, you see these 2 vaccines, Pneumovax and Influvac. These 2 vaccines are given in injection in the intramuscular route at the upper arm of the muscle, given by a special doctor or nurse. Now, why Influvac Tetra is important? As you know, it is a kind of vaccine that helps protect you from the influenza, that is flu virus. But this vaccine is not effective against existing flu virus. Already infected patient cannot be treated with this vaccine. So keep in mind. Next one, who can take this and when patient have to take this? At cold season, when the chances of flu virus attack is more, and you have to take once in a year, as there are several variety and strains may emerge frequently. So this is you have to take once in a year at least. And then who can take? The elderly patient who are suffering from certain long-term disease like asthma, heart disease, diabetes, or having weakened immune system, they can take this. And precaution before taking this Influvac, that is, if you are suffering from any fever or illness and you are allergic to a particular vaccine, or you are pregnant or breastfeeding, then you have to consult with your doctors before taking these vaccines. Effectiveness of this vaccine, it is used mainly for prevention of flu, and which actually flu virus attacks your respiratory system like nose, throat and lungs, but it is not effective against avian flu, that is commonly known as bird flu or common cold. Now how this vaccine acts? So this vaccine actually contains dead virus which actually activate your immune system in the body, which helps to produce antibodies, and this antibody is stored for the future. When in future virus will attack, this antibody kill that virus. So this is the mode of action. Now Pneumovax 23 injection, it is used for the prevention of pneumonia. Meningitis, you know, this is actually infection in the tissue covering the brain and spinal cord. Then infection in the blood, that is bloodstream infection. ear infection and sinus infection. So in that case, Pneumovax is used. Now, who can take this Pneumovax vaccine? Any child above 2 years of age, or elderly patients having 65 years of age or more than that, any cigarette smokers, or older having highest risk for pneumonia, they can take this. So how Pneumovax injection works? As like previous one, they actually activates body's immune system and produce antibodies which actually help for stored for future protection, and when in future virus will attack, this antibody will kill that virus. So I hope this video is helpful to you and give some light about vaccination for pneumonia, etc. Thanks for watching. If you have any question, feel free to ask. And this channel does not suggest use of any medicine. So before taking any medicine, vaccine like that, you need to consult with your doctor, and risk benefit ratio will be considered. Then you can take this vaccine. So thanks for watching.